syndrome is simply that the kidneys are not working well. The tubules, the filtration tubules, which is about 1 million in each kidney, the tubules and the filtration system, the tubules are not working well. So the important protein is actually leaking into the urine. So that is that, and then you can see foamy urine or bubbly urine. So that's what actually is a nephrotic syndrome. It's a leakage of a very important protein that gets into your urine instead of it to stay in your body. So that's what we know. We have a special protein that is called the albumin. Albumin is like a water magnet that regulates water in your body. It controls the aquatic pressure in your body. When we say aquatic pressure, it's the pressure which keeps water in your blood, not into your body tissues. So if this protein, you are losing this albumin into your urine, then of course this aquatic pressure will not work well. In this case, there will be too much water getting into the tissues. That's why you see people face, swollen feet and leg. And then, of course, you may see that it gets into the abdomen as well. The abdomen, water gets into the abdomen, and the person wouldn't have appetite. The person wouldn't feel hungry, and there will be more high cholesterol and high blood fat because the liver is made to produce more protein to replace what is lost. So that is the key thing here in the nephrotic syndrome. But we see the primary cause of nephrotic syndrome is the damage, the scarring that is done to the filters or the filtration system in the kidney. In the kidney, that there's a damage, there's a scarring that is done to this filtering system. There's also a problem with the memory. The walls of these tubes, the filtering system, become also thickened. It can be thickened because of malaria. It can be thickened because of hepatitis B. It can be thickened because of cancer in the body. So that can cause that. If somebody has nephrotic syndrome, it can mean a lot. It can mean that something is hidden. A disease may be hidden in the body, like hepatitis B. It can be hidden, or maybe even cancer can be hidden. And when we move on, we also see renal vein thrombosis. When we say renal vein thrombosis, what is it exactly? Here, a blood clot blocks a vein that drains blood out of your kidneys. Blood clots. Because why your blood clots? Because you see, there are some proteins that help your body, your blood system, to prevent clotting. So if you lose it through urine, then of course there will be high risk of blood clotting in your body. And if blood clots in your body, it can block the vein that drains blood out of your kidneys, and that can cause real damage to the tubules or this filtration system. And we look at the secondary causes and the risk factors. The secondary causes, if we say secondary causes, it means there are some systemic diseases or some diseases that can bring about nephrotic syndrome. And the first disease on the list here is diabetes. Diabetes is a disease that actually can cause plugging of your arteries. It can fill your arteries, which carries blood from your heart to your brain and to other organs up to your feet. And then blood actually comes back through the veins to your heart and the cycle starts. But your arteries can be plugged because of diabetes. So diabetes is a disease which is so damaging. The longer you have it in your system, controlling the blood sugar level, the more damaging it can do to your system. And then there's another disease called lupus. Lupus is an autoimmune disease that can cause inflammation in the joints and the kidneys and the other organs like the heart and lungs. You see, inflammation is the condition in the body that is a platform or foundation of diseases. In fact, many diseases. So lupus is also an autoimmune disease that can lead to nephrotic syndrome. We have a condition called amyloidosis. Amyloidosis is a rare disease. It's not too common, but it can happen. It's a buildup of protein in your organs. Actually, so if protein builds up in the kidneys, it can be a problem. That is amyloidosis. Another factor or secondary causes is that medications are mentioned. Antibiotics. Those that may be a little flu, they take antibiotics. Flu doesn't invite antibiotics. It's not antibiotics issue. Flu is about a challenge for your immune system. So you have to activate your immune system, not to take antibiotics, because antibiotics will kill actually your kidneys. Painkillers, inflammatory drugs can also kill that. Steroids can also do the same. Infections like HIV or hepatitis or malaria can also be a secondary cause of nephrotic syndrome. Sickle cell anemia can lead to nephrotic syndrome. Why? If a person is sickle cell, normally sickle cell, the red blood cell, the shape of the red blood cell is different from the regular red blood cells, and the lifespan of a sickle cell person is of their red blood cell is only between 10 and 20 days. Between 10 and 20 days compared with the normal lifespan of a red blood cell, which is 120 days, which is a really long time compared with the sickle cell anemia. If you're sickle cell anemia person, of course, you run the risk of getting this problem, that is the nephrotic syndrome. And so when we move on, we can also see the complications of nephrotic syndrome. Let's have a look at the complications. The first complication, listeners, is the blood clots. Blood clots. Because of the loss of protein that I've told you about, it can lead to deep vein thrombosis. Deep vein thrombosis, and this through that can lead to what they call PE. PE is simply pulmonary embolism. So if the vein deeply seated in your body harbors clots, the clots can swim actually towards the blood vessel which carries blood to your lungs. And if this clots actually blocks this area, this artery, if God forbid if you have a narrow artery around that area, it can cause a real bad experience. It's about breathing problem, difficulty in breathing, which can lead to a very fatal condition. It can lead to death, actually. So the blood clot can be a problem because if you lose very important protein into your urine, that can lead to unnecessary blood clots. So today we've learned that we need special proteins in our blood to prevent blood clots. And if you have a nephrotic syndrome, listeners, if you have nephrotic syndrome, you'll be losing important protein into your urine, and you run the risk of getting clots often. And if you get clots in your blood, you have a real problem. When you go to the hospital, normally they give a blood thinners, but research also shown that this blood thinners also got their complications. But we have a natural way of preventing clots. If you're interested in it, give me a call. How naturally you can prevent clots in your blood, that your blood will be flowing and not causing any problem. And also there's a tendency of high blood cholesterol and then high blood fat, that is the triglyceride, high blood fat, because their liver is made by your brain to signal to your brain signal to your liver to produce more protein, which is you are losing through the urine. And so through the production of more protein, the liver also produces more cholesterol and more blood fat. So if you go to the hospital and then you are told that you have high cholesterol and high blood fat, then you have to ask the doctor, well, please, can you check my kidneys? If my kidneys are okay, because if your kidneys are not okay, then of course you may may be losing some amount of protein into your urine, and your liver will try to produce more protein to replace what is lost. In doing so, will produce more cholesterol and more blood fat. You see why some of the reasons why we have cholesterol, high cholesterol in the blood? Let me tell you, cholesterol is not a disease, all right? Don't treat it as a disease. Okay, don't treat it as a disease at all. It's not a disease. It's a natural body substance. So if it goes high, you have to ask yourself, what is bringing high cholesterol into my body? Nothing just happens. Every time something leads to cholesterol. Another complication of nephrotic syndrome is poor nutrition. It means that when you are losing too much protein, it can result in loss of weight. You will see that your muscles will be getting very weak, and that you'll be losing weight. But if you're not careful, you will not recognize that you are even losing weight because of your inability, your body inability to get rid of water. There will be water retention. So you feel that you have much weight, but you don't have really much weight. But because of that, you are losing protein, you are losing important muscles in your body without realizing it. So you will be unhealthy person because of that. You also may experience, that person may be also anemic because your kidneys are weak. They are not controlling the production of red blood cells, which is very important for iron in your body. So if you have low iron, definitely you're going to be anemic. This also can lead to high blood pressure, because if the tubules in your kidneys are not working well, they cannot control your blood pressure. They cannot produce the hormones to regulate your blood pressure. Remember, blood pressure is controlled by the kidneys. The kidneys produce hormones to control your blood pressure. So if the kidneys are not working well, then of course they cannot produce the right amount of hormones to control your blood pressure. That's why some people have blood pressure, actually. So you see, another reason why we have blood pressure. You see, blood pressure too is not a disease. It's an indicator. It's a sign that something is wrong in your body. Nothing just happens. When we go on, another complication could be acute kidney failure or chronic kidney disease. Both conditions can lead to dialysis. But dialysis, when you go on dialysis, it means that your life actually will not be very pleasant, because the machine will only be filtering blood, but it cannot do perform all the functions that your kidneys actually perform. So that is why it's so important, absolutely important, to take care of the kidneys. And if you want to take care of the kidneys, listeners, you have to make sure you have a healthy liver. If you have healthy liver, the liver will not shift its work, that heavy duty work, to the kidneys, because kidneys are supposed to do light duty jobs or functions. So if you want to have a healthy kidneys, make sure you have healthy liver. And then make sure that you don't take too much protein, and that the table salt and too much water, and that or less water and too much protein, that is red meat, or too much meat or protein. And then not to be worried too much. If you are worried too much, your kidneys can be weak. And the Bible said that be anxious for nothing. Don't be worried. It's for nothing, because it can cause damage to your kidneys. So these are some of the things that can cause damage actually to your kidneys. Thank you very much. We've learned a lot about nephrotic syndrome. Thank you very much for tuning in. And then every Thursday, 8 p.m. to 9 p.m., and every Sunday, we have a brand new topic for you. Don't miss it. When you have the link, please share. And you can go to Dr. James Natural link, and then you can listen to all the presentation. We have a lot of presentation on YouTube, on Facebook. Just go to Dr. James Natural Link and put the topic there, just in front of that, and that topic will pop up. And please subscribe and like us. When you subscribe, whenever we do any presentation, anything new, you will get it automatically. And so that you don't miss any program. Don't miss any program. Let's get empowered through knowledge. Thank you very much, and happy Easter to you all. God richly, richly bless you. And we will actually be in touch on next, that is Thursday coming. God keep you safe. Goodbye for now. Blessings.